And it's really my pleasure to introduce John. I went online because I don't know him from Adam, and found out a lot of things.
Even when you
especially on Reddit.
And if you really want to see what somebody's about, go to their Facebook page. Yeah, it was interesting. So, Dr. John Andrew is based in Kingston, and he was a professor at Queen's University School of Business for 22 years. He was also director of an executive development enterprise for the university, and he retired in 2022. John is currently an independent wealth advisor and has also served on several corporate boards of directors. However, John is here to tell us about his experience as a volunteer. He is a licensed pilot with night and instrument ratings with more than 1,400 hours of flying experience. Probably more now since that was written. In addition to frequent flights for work and pleasure, he regularly uses his aircraft to fly medical patients as a volunteer pilot with the registered charity Hope Air. He also serves on their board of directors. So please tell us all about it. We're excited to hear.
Thank you very much. I appreciate the invitation and the opportunity to be here and tell you about a charity that's close to my heart, Hope Air. I also, well, hang on here. You need to connect here, right? Share my screen. Perfect. Okay.
And where's your
This one here. It should work.
Share.
Okay. Thanks for the technical advice here.
Slideshow. Start from beginning. Don't worry about it.
This one here
Yeah,
should
play
work,
from start.
right?
Yeah.
Okay, so hopefully everybody can see.
Bill, are you recording this?
Perfect.
See
yes.
that?
I started right before.
Right, okay.
Thank you.
Okay, thank you very much. It's also my pleasure to introduce my partner, JC Walker. So JC comes on a lot of the flights with me and is, although not a pilot, is an invaluable member of our little Hope Air group of two people. So let me ask first of all, so again, thank you for the invitation. It's a thrill for me to be here to tell you about Hope Air. How many people had heard about Hope Air before knowing that I was coming to speak? Oh, okay, that's a lot more than the Kingston average for sure. So this is, all of the photos of people here, these are all patients that I have flown, some of them multiple times. The photos are all used with their permission as well. And this is Sabrina in the middle there, standing beside me. That's her mom beside her. Sabrina lives in Sudbury and makes frequent trips to Hamilton, to the pain clinic there. So she's sort of a typical Hope Air patient that we often have the opportunity to fly. So Hope Air is Canada's only national charity providing free flights and accommodations for Canadians in financial need who have to access medical care far from home. So everyone knows we have universal health care in this country. We're very fortunate. But getting to that health care is the responsibility of the patient. We're lucky here, right? We live in Kingston, tertiary care center. You know, a number of you mentioned surgeries and healthcare challenges. You probably don't have to travel too far to access that. But if you lived in Moosonee, or you lived in Hearst, or you lived in even Sault Ste. Marie, you've got to travel a significant distance, which is not just time consuming, which is a big problem if you're working, but it's also very, very expensive, especially if you're going to try to buy an airline flight. So Hope Air provides free, non-medical, so we're not a medevac, we're not an air ambulance service. The patients are traveling to scheduled appointments, could be diagnostic, could be treatment, really runs the gamut. For patients living in remote communities who have to travel long distances to care. So Hope Air bridges the distance between home and hospital. Patients have to be below an income threshold. Frankly, that's not that hard to meet if you live in a remote community in the north, because the airfares can often be $2,500, $3,000 return to fly from your community to get to Toronto or Ottawa. Yes, sir.
What's the range of your plane? I presume that one that you.
Yeah. So my plane will do about 6.5 hours. I always tell people, because I get that question a lot in and outside of Hope Air, I always tell people it's the wrong question. It's the bladder range of the pilot. and I'm not kidding. Yeah. So I try not to, even if it's vacation travel or something, I try not to plan legs of more than about 3 hours. It's a very comfortable plane. As small planes go, it's big, and I'll show you a picture in a minute. But 3 hours is long enough to sit in any airplane. So patients have to be below an income threshold. All medical conditions and ages are eligible. So I've flown everybody from 6 months old to, I think the oldest person was well into their 90s. Hope Air, a lot of people don't know this, even if they know Hope Air provides hotel stays, meals, and ground transportation. So we have partnerships with hotel chains. We have partnerships with the meals. We use Uber Eats. Uber Eats is a fantastic sponsor. They used to just reimburse restaurant meals, and they found out that no, people, when they're receiving care, they want to be in their hotel room. They want to just order in their food from their favorite restaurants and so on. And also ground transportation. So when I fly them into, for example, Hamilton or Billy Bishop Airport in Toronto, then they can get an Uber and they can be taken to their hotel or directly to the hospital, whatever the case may be. So the catchphrase, one of the catchphrases we like to use is that Hope Air isn't an airline, it's a lifeline. We address the barriers of poverty and distance when accessing healthcare. We have 3.2 million Canadians living below the poverty line. 3 in 10 people live outside of major cities and far from medical centers. 3 in 10 will require a visit to a medical specialist at some point in their life. Actually, I think that was this year. Sorry, not at some point in your life. 3 in 10 will require a visit to a medical specialist this year. This is Hope Air's 40th anniversary. The first flight was back in 1986. A young girl was flown from New Brunswick to Toronto for cancer treatment. So Hope Air helps families avoid long, uncomfortable drives by car or bus. It's not unusual, when we talk to the patient to find out that the alternative for them was 12 or 14 hours on a bus, sometimes multiple buses. A lot of our patients do not own cars or they don't have driver's licenses. And so for them, sometimes a big challenge is just getting to the airport that we pick them up at. I want to go back here too, because I skipped over my favorite patient of all time. This is Grayson. Grayson was 1 year old at the time. I think he's 3 now, so this was just a couple of years ago. Lives in Sault Ste. Marie. This photo, actually, I've flown Grayson a few times. I didn't take this photo. This photo was taken by Silvio Roy. Silvio's a Rotarian in another group. Yeah, and he's actually the person, he's a good friend of mine. He got me into Hope Air almost 9 years ago now. So Silvio took this this photo, just, as an indicator of some of the things that Hope Air volunteer pilots do. Silvio actually, he wouldn't want me to tell the story, but Silvio actually bought this headset for this child, because when we picked him up for the first time, or I think Silvio flew him first, found out that he didn't have any hearing protection of any kind, and of course our adult headsets are too big. So Silvio actually bought him, this little guy, this headset for the next flight, and he loved it. He never tried to take it off the whole time. So the other thing that happened, so this young fellow's father was a single dad living in Sault Ste. Marie. Very, very poor, unfortunately. And we found out that he was selling possessions of his own to afford the taxi, because he didn't own a car, to get from home to the Sault Ste. Marie airport. So at the time, Hope Air was paying for ground transportation, but only at the city where the hospital was. And so I found out that, this was the situation, and that this was a significant constraint for him. So since that time, Hope Air has changed its policy and now pays for ground transportation if necessary at the home city as well. So for the patient to get from home to the airport, because none of us had thought of that. really didn't realize that could be a constraint. A lot of times a friend will drive them, but a lot of times, there is no friend available or whatever. So that was an example of how, this was before I was on the board of directors, but where input from the volunteer pilots, because we're the people that interact most directly with the patients, and by providing that input to Hope Air, they were able to say, oh, we didn't know that for some patients that's a big problem. So that was a good example. But yeah, adorable little fellow. Okay, so established 40 years ago. A lot of times, again, we'll find that out directly from the patients or indirectly through surveys. A lot of times, we'll be saving the families literally thousands of dollars per trip. And some people have to make this trip every 2 or 3 weeks. Sometimes it's every few months, but it's very often quite frequent. Hope Air policy allows the patients to bring along a companion for free. So obviously, if it's a child, that's absolutely necessary. But even if it's an adult, a lot of people have never been to Toronto before. And to go to Toronto, and it's a very intimidating place. Many of the patients have never been on an airplane of any size before. So that's a big responsibility for us as well, because they're excited, but they're also nervous. And they, and they're apprehensive about the care that they're going to receive. They're scared. And so our responsibility is to try to make this a very positive experience. And we've had really good success doing that. We've had people say, oh, this was an absolutely fantastic experience. I really enjoyed the flight. It helped me forget about my illness or whatever my healthcare challenge is for that hour and a half. And then people really look forward to the next time that they're flying somewhere with us. So there was a survey done last year with existing Hope Air patients, and it said, if you weren't receiving the transportation and the services from Hope Air, what would you be facing? 32% said that they would have ground travel somewhere between 4 and 12 hours. 30% said they would have to cancel or postpone appointments. To me, this is the most significant one. The idea that somebody would say, okay, I need cancer treatment, but I'm not going to get it because I can't take the time away from my work, or I can't afford the trip to Toronto or Ottawa or London, and so on. So that's very concerning. 14% they would have to borrow money for the trip, and that's not necessarily for an airline ticket. That might be for a bus ticket. 14% said they would buy that themselves. 4% said somebody else would make that purchase on their behalf. So how many people did we help last year? Now I want to give you the caveat, and I'll mention this later, that these are not all flights through what's called the volunteer pilot program. So that's what I participate in. Most of these are airline flights. So these are flights that are either bought by Hope Air or sometimes donated by various airlines. WestJet, Air Canada, and Porter are all partners. They all provide a certain number of flights for free, on the understanding that Hope Air will also be a major customer and will be buying flights from them. So last year, almost 14,000 flights, over 14,000 hotel stays, 9,800 meals, over 5,300 ground transfers, and then almost 3,000, so this applies to Prince Edward Island, bridge and ferry passes in Prince Edward Island and Newfoundland as well. This is this young patient, JC and I flew last year. This is Elodie. And that's her dad from Sault Ste. Marie. This was a great example of a child that absolutely loved the flight. She was excited about it. She didn't want to get out of the plane when it was done. And we didn't realize, when you look at that smile, and she was like that the whole time, we didn't realize until towards the end of the flight, and we'd been chatting with her dad about her medical treatment. Of course, we don't ask, but a lot of the passengers will volunteer information. We're a little bit of, almost therapist for them sometimes, especially on the flight home, where they've just received treatment. It might be the first time they've received treatment, so they chat with us. That's why JC is very valuable, because sometimes I actually have to fly the plane. I can't be on autopilot all the time. So I'm listening to this. I'm trying to engage with patient, but I'm also trying to, be a responsible pilot. So, and sometimes in really poor weather. So JC's invaluable there because she can, she can kind of be the main point of contact with the patient. In this case, my point is, I digress, that we didn't realize until towards the end of the flight that she was in a full body cast. And despite that, had this wonderful smile, was really, really enjoying the flight. And I think they were an example of people that had never been in an airplane before this flight, and that's not atypical at all. So again, how many people do we help? Hope Air travel arrangements soared last year to almost 46,000 travel arrangements. So that's including the flights, the hotel stays, everything you saw in the previous table. That increased over 84,000 over the prior year, ensuring that no patient was left behind. It will be even higher. So these are 2024 stats. They haven't officially released the numbers yet, but because I'm on the board, I can tell you that it was significantly higher than this in 2025. So the need is growing. People often ask, well, why is this? Well, part of it is that Hope Air is doing a great job of getting the word out to people. And and even when I talk to people primarily from a sort of fundraising perspective, but also I often have people come up to me and say, oh, I didn't know about this. My granddaughter lives in Hearst or something and is in this situation. And so we're able to put them in touch with Hope Air. And so the more people we tell about Hope Air, the more money we raise, but also the more demand it creates because people find out about it. Yes, sir.
I was just going to ask, how do you publicize this?
Yeah, so Hope Air does quite a bit of that. Most of the information is spread through healthcare providers. So Hope Air has people that reach out to the medical practitioners and say, okay, if you have a patient that you suspect, can't afford this, or that this is a difficulty of some kind, this is the website to connect them to. And a lot of the hospitals, even up north, have social workers. And so the team will reach out to the social workers and will say, because they're the ones that typically will know whether this is the travel is a big problem for them. And they'll tell them about Hope Air. But, we're kind of like, it's a double-edged sword, because the more people that know about this, the more people we can help, but the more the demand soars as well. And so we're constantly having discussions at the board level about, are we going to be able to continue? How, and again, like the volunteer pilot program that I'll talk more about in a moment, that's only 40 pilots across Canada. So the majority of these are airline flights, but the airlines only donate a certain number of flights to us, and the majority of those are purchased using donations, and those are really expensive, and often they're last minute, right? We might find out, they might buy a ticket today for somebody to be in Toronto on Thursday, and that can be a real challenge.
John?
Yes.
The question that came to my mind when I saw these kinds of growth is, as your fleet, I'll call it, increased in proportion to the growth.
No.
You're doing more flights.
Yeah, no, it's actually shrunk a little bit. And when I get to the next slide about the volunteer pilot program, I can kind of explain that. So we have more pilots than we need in Ontario, but it's in most of the rest of Canada that we don't have very many. Some provinces we don't have any. We don't have any in Manitoba and Saskatchewan, for example, and the need does exist there. So there's only 40 of us. Part of it is that it is very expensive to do, right? We're donating our time and our expenses. We get a charitable receipt for it, but unless you're able to shell out that amount of money until the next year when you file your taxes, it doesn't help. Even pilots and people that own their own planes can't necessarily afford to do these kinds of flights, at least not very many. So that's a big problem. The other thing is you have to be fairly qualified, because there's an insurance company underwriting this. So they don't want just anybody going out and picking up patients, because there's a significant liability in doing that. So we're pretty carefully vetted in terms of our experience. Of course, we have like the vulnerable person police checks. That part's easy, but it's the pilot qualifications that can be significant. You don't have to be instrument rated, but most of us are, and I would actually personally prefer that that was a requirement so that it does increase the safety level significantly.
Where does Orange fit into this?
So they're the air ambulance service, so they're taking people on an emergency basis and doing that. It's more fair to compare what we're doing with, for example, you may know that there's daily flights into Kingston from Moosonee on an airline called Air Quebec, and they fly them in. And we're kind of taking the load off that just to a certain extent. The interesting thing is that about a third of the funding comes from various provincial governments across Canada, almost none from Ontario. And Ontario is the second most active province for Hope Air, BC being the first. BC gives about $3 million a year to Hope Air. Ontario gives almost nothing. And so, they're spending a fortune on Ministry of Health flights, a fortune on them, like a few $1 million a year on those flights, and nothing to Hope Air, even though we're actually, taking quite a bit of the load off that. So, getting into the volunteer pilot program here, as I mentioned, most of the flights are on airlines, either purchased or donated. The rest of them are flown by volunteers such as myself. The good part about that is we can usually go into smaller airports that are closer to where the patient lives. And if they had, even if Hope Air buys them an airline flight, they might have a 3 or 4 hour drive just to get to that airport. If you live on Manitoulin Island, you've got to go to Sudbury. That's about 3 hours by car, if you even own a car, and sometimes more like 5 hours by bus. If we can go into Gore Bay and pick them up there, which we frequently do, they might live 15 minutes from the airport. And then, in my plane, that's about an 80-minute flight to get from Gore Bay to Toronto. So instead of, 3 hour drive, 2 hours waiting at the airport, an hour and a half flight, they show up 10 minutes before the flight. I load them on. 80 minutes later, they're at Billy Bishop Airport in Toronto.
Yeah.
So we can usually beat the airlines door to door. It's not hard to do that. Again, we're the public face of Hope Air. So again, Silvio Roy often uses the analogy of NASA, the space agency. Right, so if you think about what NASA is, right, and I think later this week there's going to be a launch with Canadian Jeremy Hansen on board. That's what everybody thinks NASA is, but that's actually at the tip of the iceberg of what NASA actually does. Hope Air's like that as well. Hope Air likes to promote the volunteer pilot program. It's cool, it's kind of sexy, I think we're great. I think we are the best part of Hope Air, but we are the tip of the iceberg. Most of the flights are airline flights, not volunteer pilot. So this is strictly VPP, volunteer pilot program stuff. So last year we flew collectively the 40 pilots, 90 VPP missions. JC and I personally did 7 of them. There are 34 different routes. You can see they're very, very skewed towards Ontario and Quebec, and also British Columbia. And in 2024, we added 10 new communities served. So more than 14,000 overall flights. So these are just the VPP ones. These are sometimes patients, these are never solicited, but sometimes patients will give us some testimonials. So I'm just going to read you quickly 2 of the ones of people that I've flown. So you've seen the photo of Elodie already in Sault Ste. Marie. Her dad wrote, when you use the program, you get to meet wonderfully awesome people who genuinely can change your outlook on life. Thank you, volunteer pilots, for everything you do. I would counter that and I would say they change our outlook on life. Every single time we fly, it can be emotionally difficult. But every single time we fly and we hear the patient's story, every patient changes you, and we get to see, we're very fortunate, very privileged, because we get to see firsthand what an impact that has. This one I can't read because it's blocked. Maybe I can read it up there. When it was picked up, this is Sabrina. I've flown many times with her mom. When I was picked up in a private plane by a volunteer pilot, I felt like I was on top of the world. These pilots have actually become part of my medical team, part of the support, help, and hope I've received. It isn't just a flight, it's so much more. Wow. So that's very, very typical. About 1/3 of Hope Air's funds come from individual donations. That's really why I'm here. The rest come from corporate donations and government support, except Ontario. So if you know any provincial members of parliament, especially on the conservative ones, please let them know. 87% of all donations. This is the amazing part about the charity. Not only is it accredited by Imagine Canada and was named, I think last year, as just look at that slide, as one of the top 100 rated charities in Canada. 87% of all donations go directly to patient transportation, hotel stays, and meals. The entire team for Hope Air across Canada is about 20 people of paid staff. The rest of us are volunteers, including the board members. In fact, not only are board members not paid, we have to donate $10,000 a year just to stay on the board.
Oh, okay.
So it's pretty significant. So it's a very small, very efficient charity that helps a lot of patients. So if you want to help, you can visit hopeair.ca, click on donate, or get involved. Now I'm going to shut up and answer any questions you've got. Yeah.
I'm just wondering, there must be volunteer or private pilots in Alberta, Saskatchewan, and Manitoba, and certainly they have outlying communities.
Yes.
So what's the holdback there?
Yeah, so we try to do outreach to them. In fact, we're planning, I think this summer, a number of us are going to kind of make a bit of a milk run and visit some of the flying clubs and some of the places, especially in northern BC. Northern BC, there's huge demand, and there's not a lot of people. There's huge weather challenges too, and that's an issue. But it's very time consuming and expensive to do outreach to private pilots. Again, we're turning down people in Ontario. We're saying, unless they live in Northern Ontario, we're saying, like, thank you, but we don't need you, there's enough of us. But pretty much every other province we need more people. So it's difficult to do that outreach and get people to be willing to do it. And again, it's expensive to do for people. The weather challenges can be a big issue. A lot of people just don't want to take that responsibility on. They don't want to feel responsible for getting somebody to a medical appointment. It is a big responsibility. But we'd love it if we could recruit people in lots of these other provinces. It is a problem. John. Yes, sir.
What's the problem? You said that most of the money is spent providing seats on commercial flights. Or commercial flights in those western provinces. Why is it happening there?
Yeah, well, again, we just don't have enough volunteer pilots. And it's the way the healthcare system's set up there. So the vast majority of people have to go either to Vancouver or Kelowna for their medical treatment. There's a lot of people in smaller communities where they don't even have the medical services that we would have in a place like Sudbury or North Bay. They've just centralized things a lot more. So there's a lot more demand for people traveling to those centers. But it would be nice if, we're always trying to get more and more commercial flights donated as well. Our best partner is WestJet, but we're making inroads. Porter just came on recently, I think 2 years ago, came on as a partner, and we're always trying to get more and more flights from Air Canada as well. They're a little bit of a more difficult difficult partner.
Difficult in
but
many ways.
they are donating some flights, so that's great.
In terms of your personal flights, there must be a significant increase in your insurance costs.
No, so personally, no. My insurance does cover me carrying anybody that I want to, and they know that I'm instrument rated, so that helps keep the insurance costs down. Hope Air provides their own insurance, which gets layered on top of yours. So if there, heaven forbid, there was an incident, there could be a claim through both my own insurance as well as Hope Air's insurance. So for that reason, my personal insurance isn't affected at all, thank goodness. Yeah. Bill, I think you had a question.
And just, I think, or a comment, how income really impacts people and their ability, and as we've done, so much of Canada got rid of rail service to many communities, we got rid of bus service to many communities. People are pulling out, so it becomes even more difficult. My wife and I work with helping Indigenous people become teachers, and transportation is a massive problem. And in our international work, we keep seeing the problem of transportation. We can't afford it,
That's right.
which means they're limited from having care, or in this case. So I really commend you for what you're doing. What is the plane that you've got?
Oh, it's a Piper Saratoga. Yeah, it's, I should have shown you an interior picture. It's actually a perfect plane for Hope Air missions because there's 4 seats in the back. So it's club seating in the back. So it's very, not that you'd ever have 4 people back there in a Hope Air trip, but it allows people some space to stretch out a little bit. It's quite comfortable for them. And there's a back door as well, so nobody has to climb. The front people have to, pilot and this person sitting beside me, have to climb in over the wing to get in, but there is a rear door there. Just over the letters G and Y,
Yes.
on the side there is a door, and it's quite big, and it opens up, and I carry a step stool, and so it's very easy to load people in and out of there. So it's quite a good plane for the missions.
As you say, you can get into small airports with a small plane.
Absolutely.
You don't need a runway that's from here to there.
Correct.
Or else you can.
Correct, and that's the most useful thing.
Can you accommodate a wheelchair, or will they have to get out of the wheelchair? Is the door that?
No, they would have to get out of the wheelchair,
Okay.
but if it's a collapsible wheelchair, we can absolutely take it. I've got quite a bit of cargo space in there too, so yeah, we can take a wheelchair.
You provide bar service on the
Actually, yeah. And the funny thing about airplanes is it's legal for everybody to drink by the pilot. If you think about an airline flight, is there alcohol on those? Yeah. It's exactly the same thing. Yeah. So they just trust that we're not going to drink. But so yeah, you could have alcohol if you wanted. I don't recommend it.
Anyone else? John?
Does Bearskin or Wasaya or Calm provide any free trips?
I can't speak to the specifics. I'd have to look it up. But certainly in BC, the smaller regional airlines do. I don't, off the top of my head, I don't think Bearskin does. But between Porter, Air Canada, and WestJet, they pretty much covered most of the major northern cities, and the rest of them we get to. Like we'll go as far north as Hearst, which is pretty far, and there's a lot of trips, kind of Hearst, Kapuskasing, up in that area, and then for stuff further north like Moosie and so on, we leave that to the Ministry of Health flights because it's just so far.
One more question.
Co-pilots, you're flying mostly without a licensed pilot besides.
Correct. Yes.
But are there some Hope Air flights where they do that or even have to do that?
There's none where they have to do it because our planes are all single pilot certified, but you could certainly bring, and I've done that as well. Most of the time she comes with me, not a pilot, but to me it's more valuable to have somebody just who can interact with the patients and the people in the back, and then I can hit the mute button if I need to, and I can be talking to air traffic control, and I don't have to be trying to do 2 conversations at the same time. But I've certainly flown Hope Air missions with another pilot. The tricky thing is we used to just be able to bring anybody we wanted, and then about 4 years ago the rules changed. Now anybody coming with me has to be pre-vetted by Hope Air, and it's a bit of a process. So it was worth doing it for JC, but if I had a pilot friend, for example, who wanted to come along, even if they're more qualified than I am as a pilot, they can't come because Hope Air, they haven't been pre-vetted.
How many flights would you be doing in a month, let's say?
Yeah, actually it's more in a year, so I'll do 7 or 8 in a year. So my goal this year is to hit 40 missions, and I've been doing it, this is my 9th year. But you have to bear in mind that the patient's only on board for 1 flight, but every mission is 3 flights, because we've got to get there, get to someone, pick them up, fly them to their destination, and then fly home. So it's usually a whole day. Typically it'll be about 6 to 7 hours of flying in a day. The patient might only be with us for 1 to 2 hours of that. Yeah. So most of the time we're just sitting there.
You get the equipment to where it's needed.
Yeah, that's exactly right. So when you hit 40, you've really done 120 flights. Yeah.
Elspeth, would you like to thank our speaker?
Yes, I would like to thank our speaker. If you could usually have a picture taken.
Oh, okay.
And maybe JC as well.
Yes, absolutely.
Rescue them.
Stand this side.
I've done with Silvio. So
Oh, wonderful,
I know him
okay.
and I've enjoyed going to his fundraiser.
Yes.
And he's become a good friend. He also often donates flights to our events. So
That's
we
right.
do, and that everything that he donates donates to Rotary, but he would also ask. So I said, Silvia, you're a pilot. When I go and visit remote clubs, do you mind? How much will you charge me to fly me there?
Right.
And he said, I won't charge you, but you can make a donation.
Perfect,
To Hope Air.
perfect.
So I would today, based on what you talked and what you told us, and thank you for being the psychologist and the not so COVID co-pilot. I'll personally make a donation, and I'm sure you've inspired other people, and I can't speak for
Well, thank you very much. That's very kind, and
them. So,
I really appreciate being here and telling everybody about Hope Air.
and I just had another thought, and that is that Rotary has clubs all over these places. And maybe we can, as Rotarians, try to connect with Rotarians in Manitoba and Saskatchewan.
There is
right.
That's great.
fellowship of Rotarian pilots.
Yes, and there's a fellowship of Rotary.
So try to recruit more in other provinces.
Wow.
Yes, and maybe Rotary can help in that way. But also, healthcare is disease prevention and cure is one of our areas of focus.
Okay.
So this fits in with Rotary, and I invite you to come and visit us more often.
I will,
Always
thank
get
you.
on
Thank you.
We would like to have you have another Rotary spin. Like,
Okay. Thank you very much. It's been terrific to be here.
thank you. So
Can you say